Tonight, the Cumberland County Health Department responding to our questions about accusations of the agency failing to tell some patients about abnormal pap smear results and also breast exams. CBS North Carolina's Amy Cutler talked to some former and current workers tonight who asked to not be identified out of fear of retaliation.
It's a program that helps more than 12,000 low-income women in our state get breast and cervical cancer screenings. 2 former nurses and 1 current nurse with the Cumberland County Health Department telling CBS North Carolina that between 2010 and 2015, women tested through that program at that facility weren't informed if their test results showed abnormalities.
I am a manager, and my department head informed me that I knew that the nurse had been let go, but I didn't know why she had been let go.
That former nurse manager and the 2 others we spoke with say the woman fired was the coordinator of the breast and cervical cancer control program. They explain it all started with a DHHS audit. It found patients weren't being alerted to abnormal test results. A new coordinator was brought in. Letters were sent out to those patients affected. But years had passed. In many cases, the letters came back. Women had moved. The manager says she asked her supervisor about that.
She said that she's hoping that they would continue to have abnormal bleeding that would prompt them to go to another GYN provider, or that there may also be a case where that person may be deceased.
These nurses say they waited, hoping the county would do something more. Since they haven't, they've come forward. We went to the health department for answers. They sent us this statement. Patient health is our top priority. Our clinics are audited by the state, internal audit, and quality improvement teams to ensure procedures are followed. If deficiencies are found, we take steps to correct them. These nurses say the health department should have been upfront about this, and they're hoping that this story helps get the word out. In Fayetteville, I'm Amy Cutler, CBS North Carolina. Cumberland County's breast and cervical cancer control program is intended to help low-income women get potentially life-saving screenings. The state telling us that between July of 2010 and June of 2016, 851 women used it to obtain pap smears. Now the county is investigating if women who received abnormal test results for pap smears or breast exams were ever informed. The allegations first came to light about a week and a half ago. That's when 2 former nurses and 1 current nurse here at the health department reached out to us. They were angry the health department hadn't done more and concerned for the women affected. They were trying to get the word out. Following our report, CBS North Carolina obtained this memo that County Attorney Rick Moorfield sent to the health director, county manager, and county commissioners. It promised a thorough investigation. That's still underway. Those nurses say the coordinator for the program, a fellow nurse, failed to notify patients, and that when the county found out, she was fired back in 2015. They claim the health department didn't do enough to follow up. In an email, Moorfield admits he knew about the accusations when it happened, that he even edited a notice given to her. Following her dismissal, Moorfield says the health department contacted DHHS. He tells us they made an effort to properly document and follow up with cases. So why didn't he inform county commissioners back then? He wrote the health department had already taken appropriate action to address each of these issues, and he maintains he's the right person to head up this new investigation.
All patients had received follow-up.
That was former Cumberland County Health Director Buck Wilson assuring county officials and the public that all patients tested as part of the Breast and Cervical Cancer Control Program, or BCCP, had been notified of their test results. Now a new, more in-depth audit refutes that. After requesting reports from the lab the county contracts to run the tests, between 2011 and 2015, 160 women with abnormal cervical screenings were identified. So why expand the review? Well, the audit committee says the former BCCP program coordinator, the one who was fired in part for failing to notify patients in a timely manner of their test results, was also responsible for notifying patients at the family planning clinic and the maternity clinic. According to the audit, 8 patients from the family planning clinic had no information in their charts to indicate they were ever notified. For another 21 patients, a notice with the test results put in the mail came back. In all, 29 women never received notification of their abnormal test results.
For them not to follow up with these people, is putting their lives at jeopardy.
CBS North Carolina included in that audit. It was our report that led the county to investigate. The latest review finding that none of the 160 patient records reviewed were handled in accordance with policy. Some patients didn't receive enough follow-up by mail. Others weren't told that additional testing was needed.
If that's what's going on, they need to do better.
The internal audit director says they've begun notifying all 160 patients and that she'll be observing the process. In Fayetteville, Amy Cutler, CBS North Carolina.
I first told you about problems with the Cumberland County Health Department back in May. Since then, I've spoken with those at the health department and county commissioners, but we haven't heard from a patient, that is, until now.
This is very frustrating, a lot to deal with.
A situation Candace Thompson shouldn't be in. She says for the last 8 years she's been going to the Cumberland County Health Department for her annual pelvic exam and pap smear.
I thought everything was well and was going okay until I went somewhere different this year.
That new doctor telling her she had an irregular cervix. She says that would have shown up in pap smears, but she tells me she was never informed of any abnormal test results by the health department. If she'd been notified, she could have gone for additional testing and follow-up. Now she says she's in danger of developing cervical cancer and has to have her uterus removed.
I really don't want to have that surgery because I do want more kids, and having that surgery, I don't have that chance anymore.
Thompson has a 4-year-old son, but at 29 years old, she hoped to have other children. She believes she's one of the 29 women who were never notified of abnormal test results. CBS North Carolina first told you about problems at the health department back in May. That report prompted an internal audit. According to the county, it looked at cervical screenings done from 2011 to 2015, and it found that all 160 patient records it reviewed weren't handled in accordance with policy. All of these women had abnormal test results.
We have requested her medical records, have not gotten those records back yet.
Alan Rogers is Thompson's attorney. He tells me they put that request in about 45 days ago.
Thompson says she's speaking out because she believes there are other women out there. She's hoping this gets the word out and that they'll come forward and get medical attention they need. In Fayetteville, I'm Amy Cutler, CBS North Carolina.
The resignation came in an email. Cumberland County's health director, Buck Wilson, notifying the Board of Health it would be effective June 30th. That was the same day the county announced the results of its investigation into the Breast and Cervical Cancer Control Program, or BCCP. 3 nurses came to CBS North Carolina. Concerned women in that program hadn't been notified about abnormal breast exams and pap smears. The county found all the women had been notified. 8 happened late.
Our resignation was not expected.
As a county commissioner, you guys did not request this resignation.
No, we didn't.
2 sources close to the county telling CBS North Carolina that Wilson's resignation was because of that investigation. On Monday, we learned the county would be taking a closer look at other health department programs. According to those 2 sources, Wilson didn't want that, and that's when he submitted his resignation.
We called, emailed, and stopped by the health department. We also went to Wilson's home. Still no response from him. We were able to catch up with Dr. Lan Tran Phu. She's the medical director for the health department. You're right under Mr. Wilson.
Yes.
Emails from the state show Dr. Tran Phu wrote the report documenting problems with BCCP. It found 385 patients had deficient follow-up in their care. How was somebody allowed to do that for so long, from 2010 to 2015?
I'm not aware of what you know. I don't comment. I cannot comment on that.
Wilson has been health director since 2009. In his email, he calls it a very successful 8 years. In Fayetteville, Amy Cutler, CBS North Carolina.
All of this is really kind of old news.
County Commissioner Marshall Faircloth, chairman of the Finance Committee, says he's just trying to make the public aware that this wasn't something that just happened. The cervical screenings were done from 2011 to 2015, and the audit committee found all 160 patient records they reviewed weren't handled in accordance with policy. All of these women had abnormal test results. 29 of them appear to have never been informed.
They should have been followed up on if they had any health consequences of this, but I'm not taking that for granted. That's why we want to know.
The audit committee completed its review back in July. Since then, Tammy Gillis, the director, says they've been working with the health department to notify those women. They updated the finance committee this morning, saying they've heard back from 21 women.
When we inquired about your report of undeliverable letters,
I first broke the story in May. That's when I learned the coordinator for 3 women's health programs had been fired. It happened back in 2015. 3 nurses claiming that coordinator never informed women of abnormal test results.
The health department actually had that list since 2015, Gillis says. Letters were sent out, and then there was someone put in charge of overseeing those women were informed. That person was Rod Jenkins. He's now the interim health director.
You seem to place a lot of the blame on this program coordinator, but there were layers of oversight over that. The nursing director, the medical director, the health director. Doesn't there need to be some kind of accountability for this?
The county commissioners have not placed blame with anyone.
Since my initial report, the health director, Buck Wilson, and the nursing director, Wanda Tart, both resigned. They say it wasn't because of the audit. The next committee meeting is in September. We'll be at it. In Fayetteville, Amy Cutler, CBS, North Carolina.